Look, I don't think that there's any question about the fact that Americans need to see a comprehensive approach to health care. Because although we have the best medical facilities in the world, the costs have gone through the ceiling. And it is disruptive to any middle-class person's cash flow and income, not to mention the lower classes. And it really is a problem. If you look at the average car that's being made in the United States, it is affecting our competitiveness there. Every car that rolls off the assembly line has in it at least $1,700 of expenses for health care that the Japanese, for instance, don't have. Okay? It immediately puts us in a
and now we own
position.
a car company because of it.
Absolutely. And so there's no question that we need to do it. But what worries me is that the government is not good at providing these services. My general philosophy towards government is that government is essential. Government plays a very important role. But government cannot provide goods and services in a competitive manner. I think we've seen this time and time again, not only here in the United States, but around the world. Every time government tries to provide goods and services, it fails. Government provides an absolutely critical role in providing the proper enabling environment. If you provide the proper enabling environment, including good regulations, proper regulations, and a public-private partnership between the public sector and the private sector, then you're in a position to maximize or optimize the output of the society. So the last thing I want to do is to see the government out there providing health care. I think that's a recipe for disaster.
It's interesting that you would say that. I was reading recently about the prescription for Medicare and the percentage of GDP that it's now consuming and how it's likely to go up. And the Congressional Budget Office has said that the year of being broke, in essence, is now 2 years sooner than it was last year.
Sure.
Because it grows and grows and grows, and the cost goes up and up and up. Meanwhile, the prescription drug benefit, whether you think that's a good idea because it's privately run and financed, is actually decreasing its percentage of GDP because it's privately run. And
Sure.
to me, that is a definite warning sign of the government being ever more involved in health care, to say nothing of lack of choice in doctors, rationing
Sure.
that you're getting. There's
Sure.
a reason why Canadians come to this country to get their health care, because they're being denied that at home.
Absolutely.